Today is November 5th, 2020. I'm speaking with Morgan Hungenberg, second interview we've had. So what's been going on since I talked to you last?
Let me see. I finished residency. Now I'm
Mazel
full-time
tov.
attendant. Thank you. Yeah. So life is crazy. It
Uh-huh.
doesn't slow down after residency. Not doing as much work in the hospital other than doing like pediatrics call, some OB,
Mm-hmm.
but not seeing adult inpatients. I'll start that in January. So
Okay.
yeah, just
There
mostly
was
working
a
in the
while
clinic.
when I remember that it caused a big stir a while ago, maybe 8 years ago or so, when Salud was not working in the hospital.
Yeah.
They made that decision in general, and a number of or some of the medical staff who had joined Salud had joined exactly so that they could continue to do hospital
Yeah.
visits. So that's been
Yeah.
resolved now, and is everybody doing it?
No, just Fort Morgan Salud. Basically, we're the only ones out of the whole Salud organization that really rotate in the hospital still.
Right, you're to be applauded for that,
It's a lot.
or get my sympathy or something.
Yeah.
So how have you been spending your time now? Well, first of all, you
Yeah.
graduated June 30th, or approximately.
Mhm. Yep.
So
Okay.
and then did you go right back to work?
No, I took a month off and then I started August 3rd,
Mm.
full time in the clinic. Mhm.
And what are you doing in clinic now?
Mostly telehealth clinic, that we have so many like OB and pediatric patients that need to be seen. I end up spending a lot of my time actually in clinic. Yeah.
How old are the
Um,
kids?
Mia's 4. You want to
Uh-huh.
say hi? Hi.
Hi, Mia. I'm Mark. Oh, those are nice ears on you.
Halloween.
Are those cat ears?
Mhm.
Yeah, yeah. Can you say
Yeah.
meow?
Yeah. Good kitty,
Hey,
huh?
yeah.
Yeah. And brother is 3 and he's
Uh-huh.
taking a nap with grandma right now.
Oh,
So
that's nice.
yeah.
Yeah.
My mom normally watches them, but she had like a procedure yesterday, so she's a little under the weather. So I said I would come help out.
All right. Well, obviously, you do whatever you have to do in the midst of
Yeah.
this. But
Yeah. You want to go watch Nature Cat though? Uh-huh. Okay.
okay. What's she watching?
Nature Cat, like a cartoon thing on
Oh, from
PBS.
After My Time.
Really likes it. Yeah.
Yeah. Okay.
Yeah.
So you've been working in the clinic
Yeah.
mostly, not from home.
Yeah. And then precepting the new residents that are in Fort Morgan. So
Mm-hmm.
that's what I end up spending most of my time in clinic, either precepting or seeing patients.
Mm-hmm.
But I'm trying to do at least one afternoon a week of telehealth.
Mm-hmm.
And all the other Salud clinics are doing much more. They're doing like 70% telehealth, 30% in person.
Mm-hmm.
But because we have so many OB patients and pediatric patients that have to be seen, we end up just doing a lot of in clinic. And when I am in clinic, I do a mixture of like telehealth and in person.
Mm-hmm. How many patients would you say you see in a day, in a clinic day?
Depends. They let me back off a little bit and ramp back up. So now I'm seeing 11 and a half day, potentially 22 patients, but we have a lot of no-shows.
That's
Yeah,
it's still so busy.
it's still busy. Yeah.
Yeah.
And a lot of days I don't have any no-shows. So
Mm-hmm.
I keep busy.
Yeah. Well, and the fact that you have so much pediatrics
Yeah.
speaks of
Yeah.
what it is that OB does for a family medicine practice. Because without it, you wind up
Yeah.
with eventually you get to be old like me, and your patients are all old too. You
Yeah.
just have geriatrics.
So someone told me, they're like, your patients age with you. Like eventually you start seeing the young kids and the OBs and yeah.
Yeah, yeah. I did when I was in Brush. I actually saw a couple of kids who were the children of people I had delivered, and that was
Oh
really
yeah.
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 That was really nice.
Yeah.
So what's it like in the clinic now? How are people? How is the staff and the clinical staff? How are you all doing?
Uh, holding on. Most of the staff got furloughed in April, and so we brought everybody back. For the most part, we did have to let, what did they say? For Salud, like 11% of employees did just get laid off. But our staff, I think we only had a couple people that just chose not to return after being furloughed. So we're back with everyone in clinic. We have a tent in the parking lot for all of our like people who are sick, and we're doing COVID testing. But with the weather changing and getting colder, we're realizing that we can't just see people in a tent in a parking lot. Like the patients can pull up in a car and stay in their car, but the providers and the EMAs, that's not fair to them to make them stand outside in a tent. So we're trying to figure out a plan of how we can like close off half the clinic and have that be like a sick area and then a well area, and keeping everyone completely separate. So that should be in the next couple weeks. Yeah.
And how's morale?
Yeah. People were doing a lot better over the summer. And like, as I came back, we had a couple new residents. I came back, we had another new attending start. So everyone was feeling pretty good. We were getting kind of back to normal. But in the last couple of weeks, we've seen a huge spike in COVID. So everyone's getting like more anxious again. And then because of the election too, everyone's just been really on edge.
So you feel like the election has really had an effect on people?
Yeah, well, we had this huge, Fort Morgan made the national news because one of the trailer park owners in town
Oh yes, I saw that.
sent out a letter and then shut off everybody's water for a day. So
Oh, I hadn't seen that.
yeah, that was new after the letter. He sent out another letter saying, I'm turning off all the water because you guys reported me to the media. So he shut off everybody in the trailer park's water for like a day. And so that just got everybody on edge and just really nervous. And yeah.
Is he out on parole?
They never arrested him, but the attorney general like sent him a letter that was like, either you turn back on the water or we arrest you, I guess, or a cease and desist letter. So he turned the water back on later that day. And the attorney general's office for the state is investigating it and might press charges.
Yeah. To clarify for posterity, this guy said that if Biden Harris were elected, he would raise everybody's rent in the trailer, like double everybody's rent in the trailer park.
He would double their rent. Yeah.
And
he said, I'll double your rent if you don't vote for Trump.
Right. And if Trump Pence were elected, he would cut everybody's rent. So that was a big news story.
Yeah.
And it sounds like from what you're saying, like it set the whole community on edge.
It did. A lot of people were very upset. And like most of our patients live in that trailer park. So I guess the clinic was getting phone calls about it too, just being like, I don't know what to do. I have a baby that needs formula and I have no water. And yeah, it was a really stressful week for everybody.
And it's just one person's action.
Yeah.
And still a fraction of the population, but it kind of sent everybody in a tailspin, it sounds like.
Yeah, definitely.
Yeah. Whew.
Yeah.
And we're still, as of now, waiting for the final results of the election.
Yeah. So everyone was really on edge about that too.
Yeah.
I was in clinic yesterday and that's all anyone talked about. Yeah.
Yeah. I've been meditating plenty. I'm trying to maintain a little equilibrium.
Yeah.
So you say up until then, though, things were, seemed to be calming down.
Yeah, the schools have pretty much reopened, letting kids go with masks, but go in person. Thing was getting back to normal until a couple weeks ago, and then everything started ramping up again. And you could tell the MAs have started asking, like, what are you as providers doing to ensure our safety and making sure people who potentially have COVID don't come into the clinic, and we have to be exposed to that, which is a very fair question. Yeah.
And now the cases in Fort Morgan initially, the big source was from the meat plant, the packing plant. Is it now more out in the community, or is it nursing home, or all of the above?
I think it's more out in the community. Someone also, like a patient, told me they work at the sugar beet factory, and they had all been together for like a meeting, and then somebody in that meeting tested positive for COVID. So they had like 30 employees that got exposed in like one very short period of time.
Oh.
And they were all worried about that. Um, our residents rotate in the nursing home, and I know they've been like monitoring and doing like twice weekly testing of employees. And so I was asking, because I had a patient who was considering transitioning from home to the nursing home. So I asked Dr. Thompson, who's in the nursing home, and he said, well, we were doing like visits with family on the lawn, but we had to stop those because one of the employees tested positive for COVID. So now they're back to not allowing any visitors. And any patient that comes into the nursing home gets quarantined for 2 weeks and then can move out into the other part of the nursing home, but still can't like be visited by family and no visitors at all. So yeah, so I think the nursing home has done okay as far as not having a lot of cases, but definitely more community spread.
How about the schools? What's going on with them?
That's been another thing. I've had parents that we have to call patients for their COVID test results. So I'll call parents and be like, guess what? Your kid has COVID. And they're like, well, they were feeling better. So I sent them back to school. It's like, now all those kids are exposed. So I've heard that, I think the school just announced this week that they're going back to strictly online. I think starting today, actually, just because the cases have been climbing in the schools.
Yeah, that's happening everywhere. And how are people about masks now out in public?
It seems to be gotten like less people are wearing them. Like if I go to the grocery store, I'm one of the few people that's wearing them.
Yeah, that was the case in
Yeah.
Greeley all along.
Yeah. Yeah.
So how are you feeling? Is this all pretty discouraging?
Yeah. I think I'm talking to patients because I've had so many patients that are just like either way, patients will try to. So, like I said, it's frustrating because I feel like we don't get a ton of information, and also just the frustration of not knowing, like, is this going to end, if ever, and when is it going to end? And, you know, it's hard. Like, my husband and I went to the grocery store the other day to get some stuff for Halloween, and the lady at the store gave me a lecture on why I didn't need to wear a mask, and I just kind of looked at her. And then later we were talking to her, and it came up that I was a physician. I was like, that's why I'm wearing a mask. Like, it's not just for me, it's for my patients too. So that was kind of discouraging and kind of weird.
This is getting really old, isn't it?
Yeah, it's hard because patients will come and you can tell like people are afraid and they're frustrated. And I want to be like, I share your concerns. Like, we don't know what's going to happen. That's frightening and frustrating. I've been lucky that I can still be around my family, and we've all been okay. Nobody's really been exposed, but it's definitely a concern and a fear.
And you said you're frustrated also at lack of information.
Yeah.
You mean medical epidemiologic information, or what is it you're
I think it's more just on like what the response is in the community and the state. It just seems to change like on a whim. Like, for an example, I have a walk with a doc program. So like a lot of patients were asking about it. Like, I was going to plan for a walk on Halloween just to get us like up and going again, just to give some people like an outlet. And I was requiring masks and everything. And then like a week before that, not even a week, like 5 days before the walk, the state came out and said, oh, we're changing our policies on group gatherings. So I was like, this is really frustrating because like I had some patients that were like, I've been suffering from a lot of depression and loneliness, and I was actually going to come to your walk. And then I was like, I'm sorry, I have to cancel it. And it just would have been nice to like be able to plan for that or know what's coming next, rather than it seems like information just changes day to day and there's not a lot of guidance with it.
How many, and I assume that Salute is though being pretty forthright about at least clinic protocols.
Yeah.
And then it's like a 5-county public health department in Northeast, isn't it?
Yeah. We're the largest county, I think, but population wise. Yeah, and I know I've talked to the health director for the health department, and she said they have meetings once a week to review. Just a sec, you can, okay? Sorry, my niece wants to show you her necklace.
Oh, good. Okay. I really like necklaces.
Hold it up high so it's in the
Yes.
camera. See? It's got fairy
Oh,
dust, huh?
and
Fairy.
oh, does that hold like perfume or something?
Yeah, what's in it? It's like glitter, huh? Sparkles.
Sparkles. Oh, nice. I really like necklaces on cats too.
You got to get your cat ears on too, huh?
Yeah.
Yeah.
Oh, thank you for showing me. Oh,
Just got the cat ears
yes.
on. Yeah. All right, why don't you go watch your show, okay? Thank you.
Oh, that's nice. Oh, I'm glad you get to be around them.
Yeah, me too. It's
That's
been a
good.
nice day.
That's good for you. So
Yeah,
before the pandemic, how many people did you have in your Walk with a Doc group?
not many. I think the most we ever had was like 10.
Uh-huh.
And so that's it. Because of the pandemic, everyone's like, I just want to get out of the house. Like, I'll wear a mask just to be
Uh-huh.
around other people and to do something. And then I had to call them and be like, guess what? We're canceling it.
Uh,
Yeah.
I know that's
Yeah.
because that's a great idea. I wish I'd thought of it way back when.
Yeah. Yeah. I wish I had too, but it's a cardiologist in Ohio started it. So
Yeah, and that's good
yeah.
for the doc too, don't you think?
Yeah.
Yeah. So, how are you doing then, or rather, what are you doing to manage for yourself this
Yeah.
stress that seems to be just never ending?
Yeah. It's a good question. Spending time with family for sure.
Yeah.
Yeah, it helps. Because I talk to patients who their family is in other states and or other countries and they can't, go back and see them. But we have a once a week family dinner. So we've been still trying to do that when we can. And all just being very respectful of each other, like, hey, is everyone still feeling safe with this? We can stop. So that helps. And then I've been doing a lot of work for the residency too, trying to do some curriculum. So I've been staying really busy.
Yeah. Yeah. And that's been going well though, the rural training track.
Yeah, it's a ton of work. We have me just coming on as faculty and another new faculty. Uh, so we've been trying to revamp the curriculum and really get it more organized. So that's been really good, but like also a lot of work.
Yeah. Well, and of course, what I learned about these alternative training tracks back when I was doing it is that this is as far as you can get from one size fits all. How to
Yeah,
every site is so different, and
yeah,
how you meet the learning needs
yeah,
at every site. It takes tremendous
yeah.
flexibility
hmm And that's
and
it.
creative
Yeah,
thinking.
yeah. Because we're like, we don't have to just model after the main tracks in Denver. We can
Right.
do our own thing and tailor it to us. So that's what we're trying to do now. Yeah.
Here's a question that's kind of off the topic, but it's for my own edification. Has the accreditors, I can't think of what that organization's called,
Oh, yeah.
have they gotten a little looser? Because they used
That's a
to,
good
it
question.
felt to me like
Yeah.
they had like 100,000 check
Mhm.
boxes about all the little things
Yeah.
the resident was supposed to be doing. You couldn't let the resident not have been exposed to. Are they
Yeah.
getting a little more flexible?
Yeah. They came out. The ACGME said
That's
if
it.
you, yeah, like the program directors have to write something that says, like, my residents' training was affected by COVID. This is how we adapted to it. And that was a big thing, was nobody is entirely sure, because this next graduating class will be the ones that are really affected by it. The first class
Mhm.
is, how is the ACGME going to respond to that? How are they going to look at residents and say, like, oh, you just get a pass because COVID happened and some of your rotations got shortened or just canceled.
Mhm.
Same with medical students. We're reviewing applications for residency right now, so I've been doing a lot of that. And all of the dean's letters say this student's training was affected by COVID. This is how. And then also the letters of recommendation too have been saying stuff like, this med student's rotation was cut short because of COVID, but in the short time I worked with him, this is what I saw. So it's going to be interesting going forward to see how all of this kind of changes regulations and how we're viewing training.
At the moment, I assume that some of the changes you're making in the curriculum are just basic changes you need to make anyway.
Yeah.
And organization you needed to do anyway.
Yeah.
Tell me about some of the things that you feel like COVID has affected in your curriculum redesign.
Yeah. I'm in charge of the didactics for the rural track. We have it once a month. We're trying to do a lot more virtual stuff.
Mm-hmm.
Also figuring out how they can do telehealth and how to like precept them when they're doing telehealth, helping them work through that, figure out how we're going to bill for that too is huge. Like attendings billing for residents doing telehealth. And then just trying to work with their rotations. Like I said, like the nursing home rotation has been changed significantly because they're limiting how many people can go in and out. So what we were doing was all the residents were, like I did this, would follow 2 nursing home patients and go and see them once a month. But since COVID has started, we just can't allow the residents to go back in the nursing home to see their continuity patients. So
Mm-hmm.
instead, we're doing just like a monthly 1-hour kind of nursing home didactics. But that's an ACGME requirement to have some sort of continuity geriatrics or some sort of geriatrics experience. So we've got to figure that one out. Yeah, so doing a lot more virtual and trying to make the best experience for the residents that we can.
I'm also interested in, are you actually doing training to telehealth where you're talking about here's how you do it? Or is that sort of like training on how to talk to, well, you do training on how to talk on the phone too.
Yeah.
But
Yeah.
is there much to be taught in that realm?
The biggest thing is precepting the residents, because a lot of them will be like, well, I just told the patient to come into clinic, and trying to say like, well, there's things you can do to, work with the patient so they don't have to come into clinic. Thinking about maybe having them tests seen, by one of the for little things, like if you just need the patient's vital signs checked or something like that. It's hard. It's hard because like we're figuring it out as we go too as attendings. So, and we all feel like we didn't get any training. We just kind of got thrown into doing telehealth.
It just happened.
So
yeah. It sounds like the issues around telehealth have more to do with what you can do with telehealth rather than how do you conduct a session. This is a huge challenge, isn't it?
Yeah. Huge challenge that nobody saw coming.
Yeah.
Yeah.
So in the case of your own training, only the last 4 months or so were affected by the pandemic.
Yeah.
Do you feel it all shortchanged?
The only thing that I would have really liked, like for the most part, I still worked throughout the pandemic. But my last month of residency was going to be a dermatology rotation. And I had it all set up like months in advance. And then they said, we just can't have you come. And they're like, but you could come in July. And I was like, I'm not going to be a resident in July, so I can't come. Mm-hmm. So that's the only thing. But for the most part, like I was already set to have like inpatient rotations and an ICU rotation. I still kept those. I think it's going to be the classes after me that feel shortchanged or feel like they got affected more.
Well, reassuringly, one of the best things to do with telehealth is dermatology.
Yeah.
So, and if they'll let you sit in, you'll learn. And I always thought, and now it's all online, but a good dermatology atlas is most of what you need.
Yeah, exactly. I found like an online dermatology course. I'm like, I'm just going to do this. It's just as good.
Oh,
yeah.
It's true. And I've also seen articles that say that a derm microscope makes a huge difference, including for dermatologists.
Yeah. We should get one for the clinic. It'd be nice.
And what do you think about the I've started to see editorials that say that the stethoscope is passé. Now everybody's going to just be doing ultrasound. What do you think?
Yeah, that's interesting because like starting in my second year of training, we started to do a lot of ultrasounding. I don't know, you have to be a pretty skilled practitioner to like really see that much on ultrasound. Mm-hmm. And you can do it. And like definitely some of our residents have bought their own like ultrasounds that they can hook up to their phones, um, and have gotten actually pretty good at it. So it'll be interesting to see what happens, but I think we're always going to like still have the stethoscope.
Yeah, well, and when you think about it, I think a lot of the stuff that the cardiologists say they can hear with their
Yeah.
stethoscopes, I think they make it up.
Yeah. I sometimes think that
It's
too.
so
Yeah.
subtle.
Yeah.
Yeah. Or how about
Yeah.
neck veins? How are you at neck veins?
Yeah.
They're either
I don't think
distended or
I've
they're not,
ever
and
heard
after
it.
that,
Yeah. Yeah. Uh-huh.
yeah,
Exactly.
I'm lost.
Yeah. Exactly. Like I look for other bigger things.
Exactly. Yes.
Yeah.
Uh, so family is one of the things you're doing to manage the stress.
Yeah.
How about the provider group or the staff? Are you guys getting together and supporting each other in any
Mm.
kind of formal ways?
Not in any formal ways. Yeah, which was interesting. Like with the residency, every year we have like a little like social to welcome the residents, and we invite the whole staff and all the providers so we can all get together. And we used to do things like provider, just like hanging out and stuff, but that's kind of all gone away since the pandemic. Yeah. One of the other new attendings, her and her husband had me and my husband over for dinner Sunday night. And I was like, I don't remember the last time we did this, like went over to a friend's house for dinner. Like that was really nice, but we don't do anything formal.
Mhm.
Yeah.
I know, and I wonder if we'll ever get back to where it was or how much in
Yeah.
that direction, because we're all getting so used to being asocial.
Yeah. It's
Um,
true.
I really miss it.
Yeah. I do too.
Yeah.
Cause like my husband and I talked about it, like maybe we should just like unofficially invite, some people over
Mhm.
just as like a welcome to Fort Morgan, just have a backyard barbecue and
Mhm.
do that. But then we just never did.
Yeah. Yeah,
Yeah.
we've done that. We've done that a little bit here, but now the weather's changing, and
Yeah.
so stuff on the patio. That's about over.
Yeah. Yeah.
Uh, so at this time, looking back on your experience during the pandemic, um, what would you do differently? And understanding that this is
Mm.
a moving target because we're always doing stuff different.
Yeah.
But
Yeah.
in retrospect.
In retrospect. Hmm. I think the biggest thing for me is like it's been really hard. Like we talked about the telehealth versus in person, and I haven't made like a very good defined line. And actually, my MA was talking about that. Like she's like, your telehealth days should be telehealth days where you don't come into the clinic. But then I always get those like patients like well child checks or procedures scheduled in there, and so I end up doing telehealth from the clinic. I wish I would have been more upfront at first about being like, no, we need to respect that. We're trying to limit people in the clinic. That's why we're doing this, and that we should be working from home if we can. Yeah, and really defining that more.
Yeah. And how are you doing at limiting patients coming to the clinic?
It's
Are they are
hard.
they starting to clamor, or have they been clamoring?
Yeah, patients are like, when am I going to see you again?
Mhm.
Or our other big schedule is or problem is like our schedulers are not medically trained. They don't have medical backgrounds, so it's hard for them to determine like what needs seen in clinic versus what doesn't. So we'll get patients scheduled on telehealth for like skin rashes or chest pain, and we're like, we can't really do much about this now. um, but
Mhm.
then patients in clinic will just be like med refills, and I'm like, they didn't need to come in for med refills. So it's hard.
Yeah. Have you made some efforts at reorganizing in teams that have people with enough, so that questions get triaged to people with enough
Mhm.
medical knowledge to make those
Yeah,
decisions?
that's a good question. I don't know. I wonder if Salud's done that. I know we as providers have been trying to like schedule our follow-up saying in person or telehealth.
Yeah.
And I've been pushing patients more for telehealth. Like this next visit can just be a telehealth visit, and being encouraging like then I just have to call you on the phone. You don't have to worry about coming into the clinic. And some patients have been like, but I like coming in the clinic. And I'm like, I know you like coming in the clinic, but this is what we're trying to do.
So I assume that's another one of your stresses,
Yeah.
is having to say no so much of the time.
Yeah. Like a patient, just yesterday told me, she's like, I don't know when I'm ever going to see you again. And I'm like, I don't know, but there'll be a day when
Yeah.
you can come back in the clinic.
Yeah.
Yeah.
Well, so yeah, speaking of the day,
Mhm.
who knows when we're going to have an effective vaccine?
Yeah.
But have you heard from patients, and have you guys among yourselves started talking about um, how to get people immunized?
Yeah. Uh-huh. So I know the hospital has. Um, I went to like a hospital provider meeting and they were talking about we need to get new freezers in place to hold vaccines, and then we need to work with the community, like the health department, to get an organized response on how to vaccinate people and also who's going to be vaccinated first. And, as healthcare providers, are we absolutely required to have a vaccine if people don't want it? Is the other hot topic. So I don't know,
Yeah,
but I
that's
know
not.
they're planning for it. So,
What's your sense of resistance in the community to vaccines?
um, just not knowing if it's tested and is going to be,
Hmm.
if there's going to be side effects to the vaccine. Like, I think a patient was talking to me about, like, well, even if they tested on so many people, there's always going to be those few people that will have an adverse reaction that we can't predict. And what if that's me? Also talk about, if we have a vaccine, is it going to be 100% effective? Is this going to be like the flu where we have to get it every year?
Hmm.
Or like the flu, if you get the vaccine, can you still get COVID? And what's that going to look like? So patients are like resistant to get a vaccine if they're not sure it's going to be 100% effective, or if there's going to be an adverse effect. Yeah.
Are those conversations coming up often?
Not usually.
Mhm.
It's few and far between.
Okay.
Um,
So
because
far.
also most of our patients are not the anti-vaxxers.
Yeah.
Like at Salud, most of the patients are just like, whatever you say, I'm going to go with as far as getting vaccinated.
Yeah.
But when I worked at the hospital, like in their pediatrics clinic, I know they had more parents that were anti-vaxxers. So I think they'll probably see more pushback than we will at Salud.
Yeah. It's more privileged white people.
Yeah. Yeah.
Who are
Our patients most of the time are just like, whatever you say, doctor, I'll do.
Yeah.
Which on some ways is good, in some ways not. So,
Mhm.
yeah.
So given where you're at now, what? Okay, and understanding that the state is probably going to be changing the rules 2 or 3
Yeah.
times a week.
Yeah.
Um, can you imagine a sort of support that would help you now? What would you like?
That's a good question. I don't know. Yeah, some sort of like reliable information about what's coming up. I know they have like a series of um, like Zoom meetings that give updates on COVID, but I just haven't been able to go to those because of like my clinic schedule. So it'd be nice just to be able to get that information not over a Zoom meeting. That's the other thing, is sometimes you just get like really tired of meetings. And so it would be nice just to have some information that could be disseminated like other ways too.
Does
And I don't know,
does
maybe it's out there.
does Salud do a good job of disseminating information to clinicians?
For the most part, yeah. Um, they send out emails about like our new operating procedures. And then our clinic manager too is really good about saying like, guys, this is what's coming. This is what you should expect. Like changes in the clinic, like putting up plastic walls to cordon off part of the clinic to be like a sick visit only portion of the clinic. So she's been really good about being like, this is what's coming. We're going to let you know as soon as we have more figured out, but we're still trying to figure out like also how that's going to look, who's going to work on that side. Because right now it's only our mid-level providers working in like the COVID tent in the sick part. So it's going to be interesting to figure out all how that goes. And then we've been working together a lot as providers just to come up with other policies too. Like we have a lot of pregnant patients that have to be COVID tested before they can deliver or go to the hospital, and trying to figure that out. And it's just like a day by day thing. It's like as issues come up, we try to figure out a solution.
Mhm.
So,
And so that's informational support. How about emotional support? Uh,
yeah.
how might Salud or Salud Fort Morgan, or
Yeah.
is there something you feel you might, well, you would appreciate that you're not getting?
It's a good question. Yeah, I think it'd be nice if we could have some sort of something as providers or like as staff, just to be able to come together and just share our experiences and what we're dealing with. Because I see the frustration in like other providers and like our staff, like our medical assistants, you know, it's everywhere.
Yeah.
And
And
yeah, I don't know how to address it.
except as catch can, where you
Yeah.
unload a little bit with an individual, you otherwise don't
Yeah.
have any kind of
Yeah.
a forum for sharing, I would say, grief.
Yeah. Yeah. Definitely.
And is there, have you been offered, is it available for staff counseling or anything?
I don't think formally it's been offered. We had someone who used to work at the clinic who's a therapist, and I was talking to her about something else, and she was just like, "How are you doing though?" And she's
Mhm.
like, "Right now on my panel, I have a lot of med students and physicians." She's like, "If you ever just want to talk, like I'm here."
Mhm.
She's like, "We need to be able to check in on each other."
Mhm.
So, like, that was really nice. And that was like a week ago. And honestly, I hadn't thought about it that much until she said something. And
So
I was like,
nobody at work kind of has the job of asking you, so how are you doing? What's
yeah,
going on, right?
yeah. I think we all kind of ask each other like informally, but we're all in the same boat. So,
Yeah.
yeah.
Whew. So speaking of grieving too, have you lost many patients to the pandemic?
I have not. I'm trying to think. I have a patient who got transferred out and just got out of the hospital a couple weeks ago. Like she got transferred to the hospital. She was in the hospital, I think, in Loveland for like 8 weeks, I want to say. Yeah. But I've been lucky. I haven't heard of any others. I did have a really young patient that died, like 39,
Mm.
back in May, and never heard what the result of that was. Like, I don't know if it was COVID, if it was something else. I need to follow up on that because we were following up on it and they hadn't completed the autopsy yet just because they were so far behind in autopsies and stuff. Trying to think if I had any other patients. I don't think so.
Mm.
Yeah.
Phew.
Yeah.
I feel like I should say something to elevate the mood for both of us now.
Yeah.
Uh, yeah.
Yeah. Well, I can tell you my niece, her mom is in nursing school right now.
Uh-huh.
So she was like, "Is your meeting like mommy's meetings?" Like, yes, just like mommy's. That's why
Uh,
she's so interested, is because her mom is doing a lot of virtual classes
oh, she's
and she's doing,
certainly welcome to
yeah,
sit in.
yeah. Oh, she's
And as
busy
it
with
is, when she
TV
grows up,
now.
she'll be able to go back and see
Yeah.
her Aunt Morgan's
Yeah.
interviews,
Yeah. And she can see
and
herself,
see
which she
herself with
loves.
mouse ear, with
Yeah.
cat ears.
Yeah. She would love that.
Yeah. Um, so what else?
Mm.
You know, we're with these re-interviews especially, and concentrating on clinicians, especially physicians. Uh,
Yeah.
we're as opposed to it being completely without structure, we're trying to at least talk about coping and how people are
Yeah.
doing that, and
Yeah.
resiliency.
Yeah.
Not with any, we don't have a theory of how it works or anything, but just kind of finding
Yeah.
out about it.
Yeah.
So that's why I've especially focused on those things today.
Yeah. I
Um,
think physicians at baseline have uh, somewhat good coping skills and resiliency skills.
yeah.
So
Yeah, I think where
I
we
think we
fall,
rely on that.
I think where we fall down is recognizing when we've reached that limit,
Yeah,
or that there is a
absolutely.
limit.
Yeah. Uh-huh.
Yeah.
Absolutely.
So if this is completely unstressed at a beach vacation, and this is the limit, and we'll say it's 0 to 100, where are you on that
Yeah.
scale?
Uh, I've got a lot of other stuff going on at work, so it's probably closer to the 100, I would
Oh
say.
my. Okay.
Yeah. Because of COVID, probably put me at like a 50. With everything else, probably more like a 70 or 80. That, and we are trying to redo the electrical in our house right now. So you've got a
Hi.
bow with your cat ears, so
Oh
yeah.
yeah. So we're having a meeting just like mommy does.
Just like mommy, huh?
Yeah.
Because she has her classes. Yeah.
Yeah.
Yeah, she had to go to school today, huh?
Oh, and what's that? That red thing.
Bow.
It looks like a propeller.
A bow.
A
Is
ribbon.
it a propeller?
Bow.
No, it's a bow.
A bow.
Yeah.
Oh, it's really nice.
Move the camera down so we can see you.
Yeah. Does that go in your hair?
There. Does it go in your hair?
Oh,
Yep. Just like that, huh?
it's got a barrette on it, huh? Or something.
Something.
Yeah. Well, it's been great talking to both of you today.
Well, thank you.
Is there anything else though uh, we should cover, or you'd like to say, or
I don't think so. I think we covered it all.
let me say this: as stressful as things are for you right now, as challenging as they are, I've spent my career in rural practice and rural education in
Mhm.
family medicine, and talking to you makes me miss it.
Yeah. Yeah.
When I hear about what your challenges are, I really want to roll up my sleeve and dive in and be a part
Yeah.
of it.
Yeah.
So
The
know
nice thing too
you
is
have,
I have really good patients who are like, yeah,
and that's why we do it.
yeah. They just tell me, yeah, they're like, I'm so happy you're my doctor and that you're here. Please never leave. And that's been really encouraging.
Yeah. Do you ever when they tell you about well, do you ever share your stress with them? Do they know how you're feeling?
Yeah. I tell them that I'm like, I'm equally frustrated. I don't know when this is going to end either. And like I had a patient, was that Monday, who was crying because her parents are in Mexico and she's here alone. And I'm like, that's really hard. And I understand why you're scared. I'm like, that's very scary. We all worry about our families. Yeah.
Yeah.
And that helped too. I was like, I don't know how much support it is, but we're all in this together. We're all feeling the same way, just so you know. And that seemed to help her.
Yeah.
Yeah.
All right. Well, I really mean this too. If you ever think of anything further you'd like to discuss, or if there's any way I can support you, or even the program, I've thought about these things
Yeah.
and been involved in these things for a long time. So anyway, I so appreciate what you're doing and the time you've taken